Hello and welcome to this special presentation on how to help stubborn, chronic neck or back pain without drugs or surgery. And hello there, my name is Dr. Vince Leone. I manage a group of specialized doctors nationwide who all have invested a tremendous amount of time and resources into specialized equipment and training so that they can deliver outstanding clinical outcomes for patients probably just like you suffering from chronic neck and back pain. So what are we going to cover today? We're going to talk about quick stats on back pain, quick stats on disc conditions, types of disc conditions, symptoms, causes, how to tell the difference between a disc condition and just a kind of a strain, sprain, muscle issue, common treatments for disc conditions, and what we do that's so different yet effective. Now, when I say disc conditions, I'm referring to, say, bulging, herniated, or degenerative disc, chronic degenerative joint disease in the spine. This is what make up chronic neck and back pain. This is why, if you've been to other chiropractors, medical doctors, or physical therapists and it hasn't resolved, it's typically due to a disc condition. So we're going to explore that today. Now, quick stats on chronic back pain. It's pretty prevalent. It affects over 30 million Americans. 8 out of 10 Americans will be affected in their lifetime. It's more common in women than men. 54% of desk workers report back pain, and 9 out of 10 patients never know the primary cause. How crazy is that? So it's really important. You have to get the correct diagnosis so that you can get the correct treatment. Quick stats on disc conditions. 80% of patients 60 years and older have some form of degenerative disc disease. 10% of patients with disc conditions will get surgery. It can take several months to heal and several months of rehabilitation. Now, for these conditions, it's usually men, 2-to-1 men to women, and 90% of disc bulges or herniations, they occur in the lower back. So let's dive into disc conditions and some secondary results. So bulging or herniated disc, that's probably what you heard or have heard of the most. Those are very common terms. Sciatica is typically a result of that. So the bulge or the herniation is pressing on the sciatic nerve, which is the largest nerve in the body. It comes out the lower back, goes down the leg. Another condition, degenerative disc disease. This is where the disc in the spine loses its height. We'll talk about why, but it's essentially losing water content. Facet syndrome. Those are the joints in the spine, and facet syndrome is when they grind on each other and essentially they wear down. Pinched nerves, it's a very kind of common term where it could be from degenerative disc disease or facet, but essentially those nerves coming out the spine, spinal column, they get pinched. And then subsequent to all of these conditions, you can get numbness. You can get numbness, pain, tingling in the back, legs, or feet. Now, again, we kind of covered these a little bit, but symptoms from these conditions, pain, of course, and that could be sharp pain, it can be achy, it can be dull, numbness, cramping. Now, numbness is not a good sign because that's typically something that has been going on for longer period of time. And when we say chronic, that's generally greater than 8 weeks. So in other words, if your condition is it's not resolved within 8 weeks, it usually moves into the chronic. Less than 8 weeks would be considered acute. But anyway, so when we get numbness, it's usually it's a more chronic condition. There's been a lot of pressure on those nerves for a long time. Cramping in the legs, in the back, in the feet, that typically comes from a lack of blood flow. So those nerves that are getting pinched, they regulate blood flow down the legs and to the feet. And so if the muscles in the legs and feet don't get their proper blood flow, then you can get cramping, tingling from pressure on the nerves, weakness. Again, that goes back to that the blood supply to the muscles. If the muscles, they start with cramping, and if it doesn't get resolved, then it turns to weakness because blood supply is fuel to muscles, burning, and again, aching. Now, what causes these disc conditions? It's typically an injury of some sort. It can be a car accident, very common, work injuries, and like weekend warrior. You may, too much golfing, too much tennis. It could be flag football. It could be, hiking, you just never know, but some type of, weekend warrior where we kind of pushed our body too far, and then it, causes that disc injury. Now, this is really important, how to tell the difference between a disc condition and just like a common sprain or strain. So sprain strain is a muscle issue, right? And so what that means is you'll get this, like if you maybe lift something awkwardly, maybe you get in a really minor car accident, maybe sometimes it's sleeping wrong, but not very often. But anyways, a disc condition is going to, again, it's going to be chronic. It's going to stick around. So sprains, like you go to a chiropractor or a physical therapist, they can usually resolve that. It should like 3-4 weeks. Like it doesn't take very long to resolve those conditions. Muscles generally heal in about 6 weeks if you have a sprain or strain. But if it's going on longer than 8 weeks, then we start to get a little concerned. Radiating pain, right? So it starts in the low back, travels down the legs. Or if we have lower neck pain, it can travel down the arm all the way to the hands, right? And again, if it's not resolved by traditional therapies, chiropractic, physical therapy, massage, then we start to think, oh, that could be a disc issue, bulging, herniated, or degenerative disc. If it's really high on the pain scale, right? A 7 out of 10, 8 out of 10, 9 out of 10, we start to get concerned that could be a disc issue. And it affects your activities of daily living. So activities of daily living, or ADLs, can be, vacuuming. It could be cleaning out your car. It could be doing laundry. It could be just, picking up the house, picking up your kids. It could be even going to work. Like if it's affecting your work, that is a concern. And so again, when it goes past 8 weeks, then we start to think, okay, this could be a disc issue. Disc issues are more serious than a sprain strain, and that's why we need alternative therapies. Now, common treatments for disc conditions. If you go to a medical doctor, you will most likely get drugs or eventually surgery. Now, if you go to a medical doctor first, they'll typically put you on pain relievers, muscle relaxers, and they'll send you to the physical therapist. Physical therapists will typically do treatment for, 6 to 8 weeks. And if they don't get resolution, then they may send you back to the medical doctor and they may consider surgery. If you go to a chiropractor, they'll typically treat you for 6 to 8 weeks. And if you don't get resolution, they're not typically going to refer you out for surgery, but they may look at alternative therapies, or they may send you back to your medical doctor for a neurosurgical consult. But by and large, most patients, when they get to these severe conditions of a disc issue that's not resolving, it's usually drugs or surgery. In the traditional model, that's not what we do, but in a traditional model. So what is it that we do that's so different and yet incredibly effective? Well, we call this laser decompression, and it is a combination of non-surgical spinal decompression and deep tissue laser therapy. So let's dive into that. And we'll start with non-surgical spinal decompression. Now, you may, if you see a provider, one of our providers nationwide, they may have that table or they may have another table. The key, very important, it has got to be true spinal decompression, okay? Don't get tricked into thinking it's traction. So some doctors have a traction table. Traction's been around forever. It's not very effective for these conditions. Traction is not very effective for these conditions. And the reason why is because traction is static. In other words, it's going to pull and hold. It's not going to, and I'll explain decompression in just a second. It's going to pull and hold, and it's non-specific. Okay, so what is the difference then? Decompression is going to pull and release, or stretch and release multiple times over the course of care. A typical treatment is usually around 20 minutes. What that does, it creates a vacuum effect in the disc. Now, when the disc is healthy, it should be around 85% water. Okay, so if it's not healthy, if it's bulging, herniated, or degenerative, it is somewhere less than that in terms of that water content, right? So the height of the disc decreases, and that's what pushes on the nerve, right? Because it bulges and it presses out on that nerve. You can see that on that picture right there. Now, the stretch and release that spinal decompression does, it creates a vacuum effect in the disc. And what that means, there's a negative pressure in the middle of the disc. It allows it to absorb water from the body, thus plumping up and getting healthy again. Now, it doesn't happen overnight. Obviously, it takes several treatments. But when we can hydrate the disc properly with spinal decompression, it's a long-term fix. And what that does, we can get up to 1 to 3 millimeters increase in disc height. Now, that may not sound like a lot to you, but that is incredibly effective when it takes that pressure off the nerve root. Okay? Now, quick analogy. Your tires on your vehicle, they get its strength from its air pressure, right? It's called PSI, pounds per square inch. So if it should be at 45 PSI, right, for your tire to be strong and healthy and so you can drive your vehicle normally. Say if it's at 20 PSI, well, think of that front left tire at 20 PSI. Well, it's gonna be almost flat, right? You're driving down the highway and it is not safe. Similar to the disc in your spine, okay? If your water content or water pressure in the disc is, half of your 85%, it's like driving down the highway with that front left tire flat. And that's why you have so much pain. That's why it's hard to do your activities of daily living. So that's spinal decompression. Now, here's where it gets really interesting. We combine it with deep tissue laser therapy. We're going to get back to that video in just a second, but we combine it with deep tissue laser therapy. Now, what does this do? This is going to increase blood flow to the affected area by 2 to 3 times. Why is that important? Because it's going to flush out all the inflammation. So when we have an injury, we get inflammation and it, swelling, edema, etc. Now, blood flow is essentially, it brings the healing mechanisms of the body. And so what happens if we can increase blood flow to the affected area by 2 to 3 times, it's going to flush out the inflammation and bring 2 to 3 times the amount of healing mechanisms to that area. That's how we can accelerate healing, reduce pain. And of course, all of our therapies are FDA cleared, safe and effective. So that's really the magic with what our doctors do. It's that combination, non-surgical spinal decompression and deep tissue laser therapy. Now let's take a quick look at this video here. And you can see it's gently stretching. Now this is just showing the stretch, it's not showing the stretch and release the multiple times. But as it stretches and releases, creates a negative pressure in the middle of the disc, then water content flows back in, takes the pressure off the nerve roots right here, and pain goes away. Again, we're healing the disc. That's why it's a long-lasting solution. That is the key. So, moving on. Is it safe? 100%. All of our therapies are FDA cleared. Now, this information may be new to you, but spinal decompression has been around for several years, many years actually, okay? Now, very few doctors have combined deep tissue laser therapy and non-surgical spinal decompression. This is the magic, and this is why we have a nationwide network of doctors that do so well with these conditions. But this whole process is very gentle, and it essentially, what usually happens, patients just fall asleep on the table. It's the first time they've been out of pain. And we have tremendous research behind our therapies. Okay. Now, is it covered by insurance? This is usually a very common question, and we want to be very upfront with you. It usually is not covered by insurance. Why? They consider it elective, kind of like LASIK or hearing aids. Why do they do that? It's because it's relatively new. Even though we have tremendous research, even though we've helped thousands of patients nationwide save them from drugs and surgery, they most of the time do not pay for this service, either laser therapy or spinal decompression. Now, are there some insurances that do? Yes, there are, but it's few and far in between. We'll always call, our doctor's offices will always call and double check, but we want to be upfront with patients. It's usually a self-pay situation. Now, I pay a lot for insurance. You probably pay a lot for insurance. I wish it was perfect, but it is not, okay? So there are some things that I need to pay for if I want to be healthy. And that's my goal. I need to take responsibility for my health, and I want you to take your responsibility for your health. So now the next question is it covered sorry, not is it covered, how much is it? It's going to, obviously there's going to be a range. Not every doctor charges the exact same amount, but anywhere from $125 to $175 per visit. And the number of visits is going to be determined by the severity of your condition. Okay. So what did we cover today? Quite a bit, right? You now know more than most people about chronic neck and back pain. And this information could really change the future of your life. If you're suffering from one of these conditions, bulging, herniated, or degenerative discs, as you know, this really affects all aspects of your life. Your ability to sleep, your relationships, playing with kids, going to work. How do I know? Because I had a serious back injury. Because it was a bad decision, but my daughter wanted to go on a zip line and it looked way too dangerous. So I said, I'll go with you. Of course, everything went sideways. We fell off going probably 10 to 15 miles per hour and dropped about 5 feet. I wrapped her up to protect her, but I landed flat on my back and I had a significant disc issue. Okay. And I actually had a compression fracture as well. That went on for months. And I went through this treatment protocol, laser decompression. I was thinking I may need surgery. It was that severe. But the point is, one, I fully recovered, but two, and I feel great right now, totally great. And that was 2017. My point is, I know what it's like to not be able to sleep through the night. I know what it's like to be taking over-the-counter medications just so I can function. I know what it's like to not even want to be at work. I know what it's like to not want to play with my kids, not be able to golf, not be able to go to the gym. It's terrible. It really affects your life. So I want you to know, we hear you. We hear what you're going through and we want to help, okay? And this protocol helps. And you do not have to go to drugs and surgery, okay? Drugs are a real problem in America today. People are getting addicted to them and doing terrible things while they're on them, okay? Surgery, now, look, I have nothing against surgeons because they are phenomenal at what they do. Most of them are phenomenal at what they do, but not everybody needs to go to surgery, and surgery should be the last resort. All non-invasive therapies should be explored before going to surgery, and a good surgeon will tell you that, okay? Because there can be complications with surgery, and there is a significant recovery process. You don't have to stop going to work when you go through our protocol. Surgery, yeah, you're going to be out of work probably about a month, and then rehab for at least 2 to 3 months. So while surgery is an option, I would highly encourage you explore all your non-surgical options first, okay? So we're not talking bad about surgeons. They're phenomenal at what they do, but you should always explore non-surgical options first. Okay, so what did we cover today? Quick stats on back pain and disc conditions. Talked about the types of disc conditions, symptoms, causes, how to tell the difference. That's a big deal, right? Because if it's just been a few weeks, there's no need to go to laser decompression or anything. Ice or heat, see your local chiropractor or physical therapist. Take it easy. This is not medical advice. Of course, this is not medical advice, but if you're in the acute phase, then it's very treatable. Typically, very treatable. So see a local provider and get treatment. But again, if it's chronic and you're not getting help, that's the type of patients that we help. So we talked about that, what we do that's so different yet effective laser decompression. Now, how do we determine if you're a good candidate? One, obviously a thorough patient history. What happened, what caused it, what have you done to try to fix it? Thorough neurological and orthopedic examination. Imaging, we're gonna need x-rays or an MRI, one of the two. Certainly bring those to your appointment if you have those and they're recent, and I would say, in the last 6 months or so. And then you'll get a recommendation of care. If you're a good candidate, the doctor is going to do all of this, right? The history, the examination, review your imaging or take imaging or order imaging, and they'll sit down with their findings and determine if you're a candidate for care, whether they can accept you for care. And then if so, they'll give you recommendations of care how long, what's covered by insurance, what's not, what's your responsibility, and how to move forward. By the way, we always have low cost financing. In other words, usually no interest whatsoever, and it's just a small monthly payment. So we don't want to let finances stand in the way of you getting care. So what to do now? Well, look, the great news is if you're watching this, you have one of our specialists, one of our nationwide specialists in your area. So on this page or in this video or somewhere, there should be a number or a button to click or to call. Okay, you will then be connected with our local specialist. Call, set up an appointment, set up an evaluation, and find out if you're a candidate for laser decompression. So my parting words of advice: don't wait. Okay, don't wait until this could potentially you could potentially not be a candidate for laser decompression, because it happens. Okay, these conditions are by and large progressive and degenerative. In other words, they're not going to get better on their own, and they're gonna most likely get worse over time. And so I would encourage you to think, hey, if where you're at now, think 1 year, 3 years, or 10 years down the road, what is life going to be like? If your sleep is affected, if your work is affected, if your relationships are affected now, if you don't do anything, what is life going to be like 3 years down the road or 10 years down the road? And so what we always try to encourage patients to do, hey, take your health seriously. Things can get worse, and we don't want them to. We want to help you now. All healthcare providers will tell you that. The sooner that we can address something, the better the outcomes typically. So don't suffer in silence. Call your local specialist provider today. Get in to see if you're a good candidate for laser decompression. So that's it for this special presentation on how we help stubborn chronic neck and back pain. I hope this has been helpful for you. My name is Dr. Vince Leone, and I wish you the best in health.